Well, and you speak to the dishonesty, and that's one of the things that really irks me about the conversations Canadians have around healthcare. Through the NDP here in Alberta, they threw more money at healthcare and wait times got worse. And then they fearmonger that Jason Kenney's going to come into power and burn down all the hospitals, lay off all the nurses, fire all the doctors, when I suspect he's probably going to do more of the same because it is a political hot potato to address innovating within the system. And it's sort of seems like evidence be damned. All we have to do is look right next door at Saskatchewan, where they have, some private innovations happening in their healthcare system, and they're seeing real, tangible results in their wait times. But that's just not a conversation most provinces can have. And why do you think that is?
Well, politicians are motivated by fear. I wrote about this recently, and we had this discussion about touching the third rail and embracing a parallel private healthcare system, the hybrid solution. Would be touching the third rail, and that would be suicide for any politician. Well, I argue that in order for the trains to run at peak efficiency, you have to touch the third rail. And I would argue that in order for our healthcare system to operate at peak efficiency, we have to touch the third rail and embrace the hybrid solution. And so the irony is that all the polling I've seen shows that 75% of Canadians want choice. They want the hybrid solution. They don't want what is being offered. And yet, and I think in many ways it's because a lot of this is being driven by unions. A lot of these groups are being backed by unions, backed by NDP types. So I find this really obscene. In British Columbia, where Dr. Brian Day is having his charter challenge, the British Columbia government spent $20 million on 20 lawyers in the first 6 months of that trial. And Brian Day was able to mortgages can be surgery, and raise some money through private Canadians giving money, raised $2 million for 2 lawyers. They have since, I understand the number is now 30 million. And by the way, this is not NDP money. This is not money out of somebody's pocket. This is taxpayer dollars being used to keep people sick and in pain and dying on wait lists. And the even better part is they tried to pass a law that no one would know what the number was. So of course I went on social media and told what the number was. I don't care if they want to put me in jail, go for it. But this is the kind of sick, absurd business. And what's really funny? People will say one of two things. You want to get rid of the public system and replace it with a private. Well, no one, Brian Day, myself, we've never said anything of this sort. And of course, the other classic is you want a U.S. style two-tier. We're number 30 and the U.S. is number 36. Why would we want to embrace their system? And then the final one is people say, well, this is just for the rich. This is so the rich can have a second tier. Well, the rich already have a second tier. It's called America. The rich don't need this. The middle class, the baby boomers, and frankly, we are the ones that are going to end up driving this. There's no doubt, because baby boomers aren't going to be waiting these crazy amounts of time for hips and eyes and knees and all this stuff. They will want choice and they will force it. But the irony is, and I've been waiting to see if maybe Mad Max was going to be the guy, if a politician, a leader, a party would come out and say, we're embracing this, we're going to tell you the truth, we're going to have that adult conversation, and here's reality, and here's why we have to do this, I think they'd win a landslide, frankly.
That's an excerpt from my weekly show, The Gun Show. It airs every Wednesday at 7 p.m. Mountain Standard Time. Each week I bring you an informal interview with an interesting newsmaker or citizen activist you might not have heard of, but who is making a big difference in Canadian politics. And we'll talk about issues in a way you'll never see done in the mainstream media. To subscribe, go to therebel.media/shows.